Scientists and researchers have discovered a new type of treatment that stops the disease and reverses resistance to immunotherapy. But before understanding all about the new treatment, let us briefly touch on how immunotherapy works. This new treatment offers hope to cancer patients running out of choices, Part 1. Doctors have discovered that this new cancer treatment has the potential to stop the disease and reverse resistance to immunotherapy. Immunotherapy is regarded as one of the best forms of cancer treatment. However, many patients are resistant to immunotherapy. Such patients neither respond to immunotherapy nor any other traditional treatments, such as chemo and radiation therapy. Scientists and researchers have discovered a new type of treatment that stops the disease and reverses resistance to immunotherapy. But before understanding all about the new treatment, let us briefly touch on how immunotherapy works. Why there is a need to know what immunotherapy is? Well, that is because the new treatment involves immunotherapy. Immunotherapy uses the body's own immune system to identify and destroy cancerous cells in the body. Immunotherapy can save the lives of patients when traditional cancer care, such as chemotherapy, surgery, and radiotherapy, has failed. While it is true that immunotherapy has been integrated with regular modes of cancer care, some tumors resist it. Some UK-based oncologists have discovered that a two-pronged treatment, immunotherapy combined with gotocitabine, can stop and reverse a cancer patient's resistance to immunotherapy. Gotocitabine is a novel experimental drug used for patients suffering from myelodysplastic syndrome and acute myeloid leukemia. According to the study, patients who were expected to die and exhausted all the other treatment options lived a much longer life after the two-pronged treatment. An article published on The Guardian mentions the following: the combination of pembrolizumab, an immunotherapy drug, and gotocitabine, a next-generation DNA hypomethylating agent, halted the advance of cancer in more than a third of patients enrolled in the early phase of first trial. The results are published in the Journal of Immunotherapy of Cancer. The dual combination could become an effective new weapon against several forms of cancer, experts at the Institute of Cancer and Royal Marsden NHS Foundation Trust said. Immunotherapy has proved to be revolutionary in the treatment of various types of cancers. While it is true that many patients become immune to traditional treatments or even immunotherapy, a combination of treatments along with immunotherapy can help the body's immune system to identify and kill cancerous cells. Although patients opting for this treatment lead a longer life, it is still left to be seen how the body reacts to the two-pronged treatment. In the next episode, we will explore more about this revolutionary treatment option for patients who have run out of treatment options.
Typically, treatments that we have aimed at cancer have been drugs that attack the cancer directly. This would be chemotherapy drugs and also many of the targeted agents we use. The great thing about immunotherapy is that the drug doesn't attack the cancer. The drug that the patient receives helps to turn on their own immune system, and it's the patient's own immune system that attacks the cancer. So I think this is the fundamental difference with immunotherapy.
How did you find this information? Please mention this in the comments section. We would also like to know the kind of content you want to watch, and we will try to create it for you. For more news and updates, follow Airr News.